Dr. Anthony Fauci, they're speaking on Meet the Press over the weekend, raising concerns about states increasingly lifting those COVID-19 restrictions, warning that it's too soon to let our guard down. All of this comes as Europe faces the threat from a third COVID wave. Italy, just the latest country to impose a national lockdown yet again to try and control the spread of the virus. Let's bring in Dr. Murtaza Akhter. He's emergency physician at the University of Arizona College of Medicine, Phoenix. Doctor, it's always good to talk to you. Give me a sense of how concerned you are. You heard Dr. Fauci there saying that it's too soon to let our guard down. When you look at what's playing out in Europe, the vaccination rate there much lower than there is in the U.S. How significant of a threat is it in the U.S. of a potential third wave?
Well, thanks for having me back. Yeah, no, I think Dr. Fauci is totally right. I mean, we get mad at football players for celebrating too early because you got to really get to the end. And we aren't at the end. We aren't even close. We've got a lot of vaccinations still to do, and I'm glad we're doing as well as we have been doing. There are still a lot of people who haven't been able to get vaccinated. And that includes the elderly, by the way, the ones who are most likely to get sick and hospitalized. And so it's really crazy to me that some of these states have decided again, it's basically the 5-yard line. I think that's a great analogy where these states have decided we're not even going to bother making the end zone. We're just going to tell businesses to open up and not wear masks. It's so easy to wear a mask, especially for like 2 more months. I mean, the amount of numbers and lives we could save by just holding on to what we've been trying to do for the last year or so for just another 1 or 2 months. It's appalling to think that we're already kind of saying that it's over. It isn't over. I still see them in the hospital. We've got just a little bit longer to go before we can really significantly decrease the chances of people getting hospitalized.
Yeah, and relative to going out and getting a vaccine, certainly less effort, I think, to wear a mask. But when you look at that, getting a vaccine, some interesting moves across the pond in Europe, when you think about countries now pumping the brakes on AstraZeneca's vaccine due to some possible side effects and clotting issues, though the company is saying that those are not necessarily linked to the vaccine. What do you make of that? Because AstraZeneca's vaccine's a pretty important piece of Europe's vaccination path forward. So to see Germany and the Netherlands say they're going to stop for a bit there seems like a big development. What's your take on maybe that, and also the decision by some Americans, even back here at home, to not want to get the vaccine, particularly among Republicans?
Boy, that is a loaded question. So as for AstraZeneca, as you know, that's been used more heavily in Europe than it is here. It hasn't been approved here for people to be getting the AstraZeneca vaccine, so it's an issue that they've been dealing with. There seems to be some concern about clots, but it doesn't seem to be exceedingly high. Definitely doesn't seem to be as bad as deaths from COVID. So we'll have to see for what those actual data bear out. But remember, there are really great other vaccines that are available, in particular in the United States, where we don't have that issue with thromboembolisms with either Pfizer, Moderna, or Johnson & Johnson, as far as we know. So there's really no reason to be hesitant here. I mean, there are some people who have potential concerns with anaphylactic history. And even then, the mRNA vaccines aren't coded in anything that should cause anaphylaxis. But any story of AstraZeneca and Europe, it should be fairly moot to Americans. Clearly over here, a lot of people have made it political. It has nothing to do with blood clots. It has everything to do with politics, or a lot to do with politics, when so many Republicans aren't getting vaccinated and Democrats are. Obviously, the coronavirus doesn't care if you're a Republican or a Democrat. It will infect you regardless. The only way it'll show favoritism to one person versus another is based on vaccination status. Vaccines clearly help reduce the risk of transmission, and in particular severe disease and hospitalization. And so I think it's critical, if people want to get back to normal, to mask up and get vaccinated. And if they don't, they can continue to isolate. But our penchant has been to not do that, which is unfortunate.
COVID-19, of course, not just a U.S. problem. Globally, vaccination has been much slower than it has been in terms of the rate that we've been seeing in the U.S. I wonder what you make of the conversation around vaccine nationalism. You've got countries like India now accusing the U.S. of essentially holding back some of their supplies. You've got Europe now looking at Russia's vaccine because they haven't been able to get the supply on board with some of these other drug makers. What do you think are the implications from a medical standpoint, trying to get everybody vaccinated when you've got what appears to be increasing tensions between countries?
Yeah, I mean, the biology of it is almost fairly simple compared to the politics of it. From a physician standpoint, I'll reiterate what I just said. COVID doesn't care what your nationality is or race or religion. It will infect you. And the only way it shows a preference is based on social distancing measures and masks and vaccination. So if a certain group of people, ethnicity, religion, or race or otherwise, is vaccinated and another isn't, you'll exacerbate disparities. As for the politics of whom gets it and whom doesn't, and who had the first contracts and who didn't, that can get very complicated, but every global health expert says if we don't vaccinate everybody in the world, including the underserved, it's going to come back to harm us anyway. And again, not to get too political, but the numbers on vaccination in Israel have been amazing, like really amazing on how much they've reduced hospitalization. But their occupied territories have not been able to get the vaccine in a lot of cases. And so again, I'm not a political scientist. It seems to me that if you're going to occupy a territory, you should probably vaccinate its people. But again, maybe I'll get hate mail for that. I will say biologically, the vaccine doesn't care if you're Israeli or Palestinian. It will infect you unless you're vaccinated. So I think there's a big impetus on the people who have the power to do so to be able to give the vaccine to the people who can't get it and really try to keep the politics out of it.
And Dr. Akhter, lastly, I mean, back here at home, it was interesting to see one study come out and talk about social distancing. You mentioned that 6 feet has always been kind of the sign out there, no matter which parks you go to, saying keep 6 feet. This new study says 3 feet in schools, in classroom settings, might be sufficient. I mean, we talk so much about making sure we can reopen the schools and really have that come back. How significant is that in the grand scheme of things? If it's just an additional 3 feet here, is that worth highlighting as important in that goal?
Remember, there are a bunch of places that have been able to put kids in school where the kids are actually masking and distancing. And remember, early in the pandemic, we were afraid that kids wouldn't be able to mask up. But they've done an amazing job, way better than adults, in my opinion. And I see this in the ER too, by the way, where my adult patients are taking their mask off and the kids are like telling their adult parents to put them back on. It's like amazing what kids can do that adults can't. And so I think we can argue about 6 feet versus 3 feet. But the really important thing is if everybody's wearing a mask, then regardless of 3 versus 6, this should be okay. Not always, but this should be okay. And by the time vaccination is rolled out, then it'll be even more okay. By the way, there's no classroom I was ever in where I was seated closer than 3 feet to any student. It was usually at least that, if not more. And so again, I think the CDC recommendation is a big deal to schools and administrators in terms of how they distance the desks. But remember, from the biological standpoint, if everybody's wearing masks and not licking each other and coughing on each other, then the chance of viral spread is very slim as is.
Well, Doctor, it's always good to have you on to get your insight on the very latest news around COVID-19. Dr. Murtaza Akhter, emergency physician at the University of Arizona College of Medicine, Phoenix.